All right, you're dispatched to a 56-year-old male for shortness of breath.
Okay. Besides my scene safe.
Yes, sir.
All right. Looks like I have one patient.
Yes.
Correct. I'm gonna request for additional resources. I'm gonna determine this as an NOI and an MOI based on the nature of the incident. And do I need to consider spinal precautions, spinal mobilization?
You walk in, you see a patient sitting upright in a chair, working hard to breathe. No trauma noted.
So my general impression is that I notice a patient with difficulty breathing.
Yes.
Okay. Is he tracking me as I walk up to him?
He kind of recognizes you're there, but he's working so hard to breathe that he doesn't like focus on you very long.
Okay. So he is alert in the AVPU scale. Do I notice any life threats or any major bleeding?
No.
Okay. So I'm going to go up to the patient. I'm going to check patient's radial. What is the rate, rhythm, and quality?
Notice to be fast, regular, and weak.
Fast, regular, and weak. And then I'm going to do my ABCs. So is there any cyanosis or any accessory muscle usage?
You note him to have some accessory muscle usage and nasal flaring.
Okay, so I'm gonna ask my partner to get some vitals on the patient. I'm gonna want pulse ox, oxygen saturation, blood pressure, and capno. I'm gonna listen to the patient's lung sounds really quickly.
Wheezing, expiratory wheezing, wheezing.
Okay, so he's the patient has difficulty breathing, so and he has wheezing, so indicative of bronchospasm. So I'm gonna start him off by putting him on a monitor breather. Start him off at 10 liters per minute. Okay, so I'm gonna ask, is the patient having difficulty speaking?
Yeah, so they're, if you ask them something, they're talking in like 1 to 2 word sentences.
Is there family on scene that could help me explain what was going on?
Yes.
Okay, so what happened? What's going on?
The wife tells you that he was outside doing some yard work and then came in, was complaining of shortness of breath for like the last couple hours, and it's just progressively gotten worse.
Doing yard work, and do I notice any, I'm gonna expose the patient, do I notice any hives or anything like that?
No.
No, okay. And the patient has 135/85, so he's not showing signs of anaphylaxis, so it might just be from exercise, from can't think of the word, but expelling energy. He has a history. What kind of medical history does the patient have?
He has a history of asthma.
Okay, so I'm going to, he has a history of asthma. He's showing, on the capno, he's showing shark fin, which is indicative of bronchospasm, so I'm gonna start him on a nebulizer treatment. So before I give that to the patient, I'm going to do my 9 rights. So I could, drug dose documentation, patient education time, right route response refusal. I'm gonna do nebulizer treatment with albuterol. It's going to be 2.5 milligrams and 3 mLs. So I'm gonna cross check with my partner. Albuterol. Okay. I'm gonna bump him up to about 15 liters per minute, just because his oxygen saturation is not improving right now while I set this up. So, gonna remove bag. Nebulizer treatment. I'm going to bump it down. Okay. So yeah, we got 4 lead on board. We got albuterol on board. He's on oxygen therapy. While I assessed this, I was touching the patient. What was his skin color, temperature, condition?
So it's warm, pale, and clammy.
Warm, pale, and clammy. Okay. Is the patient experiencing any form of pain?
No.
No. Based on the presentation of the patient, the interventions that I need to perform, my transport decision is to stay in play. So I'm going to continue assessing the patient, see if there's any improvement on with the albuterol treatment. And then if that doesn't improve, then I'm going to progress to Duaneb, which that is 0.5 milligrams and 3 mLs of albuterol. Okay, so going to reassess the patient's lung sounds after administering the albuterol.
You still know wheezing, but it has improved some.
Okay, in all fields?
Yes.
Okay, so I'm gonna, based on the fact he's still sitting at 80%, they're still showing shark fin on the the capnography, the waveform. I'm going to now administer Duaneb, so I'm gonna cross-check with my partner. I've already done my 9 rights, so Duaneb. Okay, so after administration of the albuterol, I'll put Duaneb in. Okay, so now that's being administered. And then I'll continue reassessing the patient. The patient is, he's presenting with a bit of tachycardia, but that is a side effect of albuterol, so I'm not too concerned about that. We want to reassess the patient's pressure. Okay. In the meantime, I'm going to look at the patient's 4-lead. Get the 4-lead on board, or 12-lead?
Yep, I got 12.
Okay. And you said the patient is 56, so I'm going to adjust the patient's age. And then I'm going to capture it. See if there's any cardiac involvement in this. So, in the meantime, okay, hold on. So, I don't see, looks sinus tach in lead 2, and then I don't see any indications of elevation or depression in any of the leads. So, don't know any cardiac involvement, so just presenting sinus tach, which is appropriate for the treatments that I've administered the patient. So, I'm gonna ask the patient, do you feel any relief, or is there any improvement in the work of breathing?
He says a little, but not really.
A little, but not really? Okay. So, I'll listen to lung sound, see if there's any improvement, but he's setting at 84%, so I'm going to want to continue treating that.
Still wheezing.
Still wheezing?
Wheezing.
Okay, I'm gonna ask my partner to drop Epi 1 in 1,000. I'm gonna want 0.5, and we're going to administer that IM on the lateral thigh. I've already done my 9 rights, so it's the next form of treatment to help out, assist the patient. So no pain, so OPQRST. I've already asked for pain, so onset, he's not showing any signs of pain or anything like that, so OPQRST is handled. Signs and symptoms, he's presenting with muscle usage when breathing, and he has difficulty breathing. Does he have any allergies to any medications?
No.
No. Does he take any medications?
He takes lisinopril for high blood pressure and statin.
Okay. Past medical history, you said that he has asthma, correct?
Yes.
Okay, and then last oral intake?
Well, asthma and high blood pressure.
Okay.
He had breakfast before he went outside to go to work.
Okay, asthma, high blood pressure for the history, and then he recently, and then events leading up, we already asked that he was outside doing yard work and everything like that. So once you get the epi, I'm gonna cross-check with my partner. 0.5.
5.
Okay, pass.
Here you go. That's what he used.
Okay, so we're cross-checking epi 1 in 1,000, and we're doing 0.5 RM. Just a needle. Okay, I'm gonna clean the site. I'm gonna tight and tell the patient it's gonna be a small poke in the lateral thigh. 1, 2, 3. Okay, 0.5. If you want to 1,000 administered. Okay. In the meantime, could you get me an IV established, please? Gotcha. Thank you. Okay. So he's a bit tackier, but again, it's a side effect of epi, so I'm not too concerned about the tacky presentation. He's setting at 90%. Yeah, reassess the patient again after I given another drug. See if there's any. Is it easier to breathe? Or are you still having difficulty breathing?
It tells you that he's feeling some relief, but it's still a little difficult.
It's still a little difficult, and then I'm going to assess lung sounds again, see if there's any. Oh, let me exit out of this so I can look at the capnography. Okay.
So it has opened up a lot more, but you still hear like slight wheezing, but
Okay.
you are hearing more airflow.
I gotcha. In all fields?
Yes.
Okay. He's still, his capnography is 45, so still a little high. He needs to be between 35 to 45. I'm going to reassess the patient's blood pressure. He's, again, presented with tachycardia. Not too concerned about that. He's still having difficulty breathing, so next treatment I'd like to administer would be, we do mag and insulinumab. So I'll do, I'm gonna do mag, and that's gonna be, I'll do 2 grams in a 100 cc bag of D5W. I'm gonna give that IV, so my partner's administering an IV, and in the meantime I will drop 2 grams of mag, which is
At 128.20. Water for purple. Respond on dispatch 3.
so I'm gonna do 4 mLs. Hold on, do a cup. Oh yeah, sorry. So, in the meantime, since he is still having difficulty breathing, I'm going to also put on CPAP. I can do that really quickly.
Give him 20 establishes
Thank
one.
you. Okay, for Joe, if you can draw me up 2 grams, which is 4 mLs of mag, and I'm going to put on this CPAP on the patient.
41. Royal Palace. Respond on dispatch 3. 723. And squad
Okay, keep us
33.
in line.
So 2 grams
Yep,
of mag.
2 grams of mag. I'm going to move, I'm going to hook this up down here.
Stand by. At GF
And I'm going to
Respond on
do,
dispatch 1. Medicaid 36.
7.5 PEEP, which is, I'll start off at 10 liters per minute. Right here. That's hooked up. I'm going to remove the non-breather. Photography. I have inline on board. I'm going to explain to the patient that this is going to assist with his breathing. It's going to feel a little kind of like he's sticking his head out of a moving car, but I promise that it's going to assist with his difficulty breathing. Okay, now I'm going to make the proper adjustments. You're right. Here we go, CPAP on board. All right, so once I got that on board, setting 94. Okay. Yep. We're gonna do this as more maintenance. He is setting appropriately. Capnography is still showing some shark fin. His capno is 48, but it's just slightly. Okay, 44, so it's improved. So he's within range, and he's not presenting with shark fin anymore. So he is his waveform is presenting appropriately. I'm still gonna give this as maintenance because he. How's his work with breathing now, or how's his difficulty breathing? Is he still?
He's not tripoding as much.
Okay.
He more like engaging more. He's not as stressed about his breathing, so you have noted an improvement.
Okay, so I'll still give this more as maintenance. I'll do the mag sulfate, which I'm gonna do 2 grams again in a 100 cc bag of D5W. Gonna give it IV. Cross-checking my partner already. I did mine already, so got the mag on board. Okay, so in the meantime, while he is presenting appropriately and his work of breathing has reduced and he is breathing appropriately, I'm going to pause time. I'm going to put him on the stretcher, and so.
All right, pausing time.
Okay.
Patient going to stretcher.
Yep, we secured the
We don't
patient on
have
the
a
stretcher.
stretcher.
Okay, so in the meantime, since I have all the interventions on board, I'm going to do a more thorough head to toe. I'll do this in my secondary. So I'll start with the head. I'm going to check the patient's eyes. Pen light.
Pearl.
Pro. Do I notice any hematomas or any decapitalis in the head? Any fluids coming out of the ears, nose, mouth?
No.
No? Okay, so then any tracheal deviation or JVD present?
No.
I'm gonna reassess the patient's lung sounds again.
Clear. 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 Clear.
Okay, perfect. And then, any crepitus on the patient's chest or anything like that?
No.
Okay, I'm going to palpate each quadrant of the patient's abdomen.
Nothing
Okay.
noted. Soft, non-tender.
Soft, non-tender, perfect. And then I'm gonna work down each extremity. Do I notice any deformities or any, no? Okay. I'm gonna check PMS really quickly. How's his radial?
You note a fast, regular, and strong radial.
Okay. Is he able to squeeze my hand?
He is.
And cap refill?
Less than 2.
2. I'm gonna do the same thing to this extremity. Any abnormalities or any
Nothing
PMSs?
noted.
Okay. So pelvis stable intact.
Yes.
All right, and then I'm gonna work down each extremity, lower extremity. Any decap BTLS?
Nothing noted.
Okay, and then pedal pulse present.
Yes.
He's able to move his foot, wiggle his toes.
Yes.
All right, I worked down this leg as well. Same thing.
Yes.
Okay, so GI. Okay, so I don't think reproductive is necessary this time. So I already assessed cardiovascular, pulmonary, integumentary, everybody, psychosocial. He's responding appropriately. So all body systems have been assessed. I'm going to make the field impression that this patient had a COPD exacerbation. I believe that, so I'm going to be reassessing the patient every 5 minutes, and I'm going to make my radio report to the receiving hospital. At this time, I have my partner drive, and I make my radio report.
All right.
So, Medic 6 is a D5. I apologize. D5 is a Medic 6.
Make 6, go ahead.
I have a 56-year-old male that was initially presenting with shortness of breath. He was tripoding using accessory muscles. His oxygen saturation was, he was hypoxic, and we have given the patient, he's currently on CPAP. We have administered 0.5 milligrams of epi. We have given the patient albuterol, Duoneb, as well as 2 grams of mag sulfate. His current vitals is 123 heart rate, 155 over 93 BP. His capno is 40. He's sinus tach, and his oxygen saturation is currently 98. We'll be arriving in about 5 minutes.
We copy. See you then.
All right.
Anything else you'd like to do?
No.
Thank you for your service.